Welcome back, beautiful tri-state area. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. I'm your host, Zen Sams. Up in just a few minutes in the Going Deep segment brought to you by CO2Lift in our Expert on the Microphone series. Today, we're joined by the founder and CEO herself, Lana Kerr, and she is featuring Reggie Gatewood, former pharma-executive and co-founder of Corganics, which is a company with the mission to become the most trusted and recommended cannabinoid company by healthcare professionals. Prior to Corganics, Reggie was responsible for the launch of several well-known products into the U.S., including the cardiovascular blockbuster Plavix and the very well-known aesthetic biostimulator Sculptra. With the CBD and skincare and cosmetic market experiencing exponential growth in recent years with no sign of slowing down, they're going to join me today to break down how both CO2Lift and Corganics are easing patient comfort and well-being, and more importantly, changing the post-procedure healing routine. Welcoming now to the show is Reggie Gatewood and Lana Kerr. Welcome, superstars.
Good to be here. Hi there, Zen.
Great to be here. Thank you.
So excited to dive into one of my most passionate topics, cannabis and carbon dioxide therapy. So Reggie, I'll start with you.
Sure.
As the co-founder of a widely trusted cannabinoid company, you've found yourself in the perfect position for success with CBD product sales rising from $108 million 10 years ago in 2014 to close to $2 billion in 2022. However, with this clear rise in interest, still, according to a Forbes health survey, 1/3 of US adults just don't feel confident in their understanding of CBD, such as the differences between full spectrum, broad spectrum, and CBD isolate. So clearly, education is still vital in this department. So for our audience who may be less familiar with cannabinoid therapy, can you first explain in simple terms how it works and interacts with the endocannabinoid system?
We all have an endocannabinoid system. Think of the word itself. Endo means inside. Okay. Cannabinoids are naturally occurring chemicals that we already produce very naturally. So if you think about endocannabinoid, that system is in place to help us maintain homeostasis. Our bodies are constantly trying to get back to a state of natural balance. However, it's not easy, especially environments that we put ourselves in, and the including food or just the environment itself. And so for cannabinoids, or we'll use CBD as an example because you're familiar with Zen. And so cannabinoids interact naturally with this system. And so if you can help this system maintain functionality or even enhance its functionality, that might show up in ways of how we experience pain or how we sleep or how we experience anxiety or overall just the inflammatory response. And so really, in short, that's kind of what the system's meant for us to do, and how products like Corganics clinical CBD can interact to help that system perform optimally.
Fascinating. The answer has been under our nose the entire time. Plant-based, a 100-year-old plant. Now, at Corganics, I know you offer several clinical CBD products, and after launching your first product back in 2022, you quickly became the most trusted cannabinoid therapy by healthcare professionals across multiple specialties in the U.S. So let's talk about just this. How is Corganics working to reintegrate healthcare professionals who were previously per se excluded from the conversation regarding CBD therapy to become a trusted source on the potential benefits to support the well-being of their patients?
So our products are only available through healthcare professionals, and this is exactly why. We want to bridge that gap between the healthcare professional who may have heard of CBD, probably get asked about it frequently by patients, but aren't just real confident yet on how to respond or even approach it. However, we know their patients are out there treating, like you said earlier, millions are spending billions of dollars. And so our goal is to bridge that disconnect between the patient and the healthcare provider. Well, in order to do that, you're going to have to earn the trust of both the healthcare professional and the patient, and that's going to be through education. So healthcare professionals are responding very positively, by the way, to education around the market. Hey, look around you. It's right under your nose. 1 in 4 Americans, according to Gallup, are utilizing some sort of cannabinoid therapy. Many of them are self-treating, but they're going to a retail market that may not be safe, and the products aren't third-party tested. And so you need to be involved in this conversation as a healthcare professional. So it's education around the market, education around the science. So the ACS itself, what do they know about it? Well, it's not really taught a lot in med school, right, or in medical schools, or in pharmacy school. So our goal is to help bridge that gap around the science. And then, of course, you've got to bridge the gap with their staff and their office, but also their patients. And so at Corganics, because we're former pharma executives, Chad Collins and myself, the co-founders, we provide a bevy of resources, whether it's healthcare professional education from Corganics U, or down to the staff, or down to the patient themselves with education that looks similar to this. But we want them to make sure that they know it's a surround sound of education and also resources to help them have that conversation confidently.
I love the 360 approach. It's truly what's needed. Now, Lana, I'm going to switch to you because this is such an important conversation that we're having right now. And your company is really revolutionizing a lot of pre and post procedure care. So CO2Lift, specifically CO2Lift Pro, shares this mission with Corganics to ease the comfort levels of patients. It's always been at the heart of everything that you're doing. And I know that the CO2Lift Carboxy Gel is the only proven medical grade topical carboxytherapy treatment that doctors recommend. And CO2Lift Pro is also the strongest version, which can only be provided to patients by medical professionals. So this aligns perfectly with what Reggie is doing. So aside from its monotherapy benefits, I'm letting the audience know this, that it lifts, it hydrates, it tightens. It's often used in conjunction with other cosmetic procedures. We've been talking about this for over a year now on the show. So Lana, in your opinion, why is it so important these days to minimize a patient's downtime post-procedure? And how does CO2Lift play into this specifically with Corganics?
Yeah, I think it's important because more and more patients, consumers are just informed as to what's available to help speed up healing. People today want something quick, and what we're seeing is that not the surgery is important, but just as important is the post care, because it's not only going to prevent complications, it's going to speed healing, but it's going to enhance the results. And like, Reggie's product, I mean, CO2Lift has been around for a very long time. Carbon dioxide therapy has been around. It's just now people are being, especially here in the United States, are being educated as to what it is and their benefits. So because of the rush of oxygen, it's going to rapidly heal. We're talking about minimizing the downtime by as much as half the time. Also the swelling. I think when I think of surgeries, one of the enemies to surgery is inflammation and swelling. And the CO2Lift is very effective at preventing the swelling and the inflammation and reducing the bruising time.
Now, staying with this theme, Reggie, as someone who was responsible for the launch of a well-known cosmetic product like Sculptra, you're familiar with the challenges a patient may face post-procedure. So coupling this with your knowledge of CBD therapy, what are the primary benefits of using Corganics products and how can they help aid in the patient's recovery process?
That's a great question. It goes back to I'm going to go back to simply the role of the endocannabinoid system. And so, once a body has been had a procedure and gone through whatever that procedure is, it immediately starts the journey back toward a more balanced, healed state, right? And so, like Lana's products help certainly with that's the tip of the spear relative to the swelling and the inflammatory response, but also your endocannabinoid system is also helping to lead that charge back toward, or that journey back toward, recovery and balance. And so for Corganics, look, we play a critical role helping, whether it's post-recovery, maximizing sleep, or in easing the anxiety that was associated with the procedure itself. But also with the endocannabinoid system, you know that there's much data around reducing the inflammatory response. And so as Lana so eloquently spoke to, her product definitely helps that, as well as systemically, you've got a system that's helping it sort of from the inside out. And look, if we're going to create an exquisite experience from the beginning, during the procedure, and then after the procedure, then let's bring products in that help us speak to that more naturally, and also probably meeting a lot of patients where they're already at with that process to help them in that journey.
Now, I know verification and evidence-based backing is extremely important to both of you. So, Lana, can you touch on why clinical trials and testing are so crucial in advancing therapies, and and mainly how they help ensure both safety and effectiveness for patients?
Today, I feel like trust in companies, trust in products is at an all-time low, for the reason that there's so much misinformation out there. I mean, you hear the stories of even people using pictures from other companies and using it and saying it's their own. Those things create a lot of distrust. And then there's a sea of products that are available to help solve the so-called issues, or the issues that we're facing, where we're discussing right now. So I think it's so important for a company to invest in studies to prove the efficacy of the product and the safety of that product. And that's one of the things that I like about what Reggie's company does, and what we did from the very beginning. Before we even launched the product, we used the gel, we compared it with the injectable version to compare and to see how effective is it. Is it the same thing? And the data shows it. We see it anecdotally, but we see it clinically.
Now, Reggie, I know Corganics products are all rigorously tested with extensive third-party testing and IRB-approved data separating you from retail versions of cannabinoid therapy. So I'd love to hear your opinion on the importance of testing as well.
Well, for us, it's paramount. And so, as I mentioned earlier, let's go back to what's happening in the retail setting. Almost regardless of whether it's oral, topical, whatever it is, you're talking about upwards of 88% of what's out there is mislabeled. And the majority of them do not test for heavy metals, molds, microbes, pesticides. Yeah, exactly. And so most patients don't know that. They assume if I can find it on a store shelf, it's probably going to be okay. And the reality is it's unregulated. It's the Wild West. And so at Corganics, if we're going to bridge that gap, trust is the first step, as well as education. And so for us, it's just a no-brainer. We have to third-party test. And then we make those results of the third-party tests transparent. On every one of our bottles, you can look up by batch what the COA says, the certificate of analysis, just to show that's step one. Step two, we invest in IRB-approved data. We have an IRB-approved studies. We invest in patient studies too. And so most recently, we have one that looked at overall well-being. And so without going into the details, it's critical if that journey toward well-being, you think about what you're talking about relative to the post-procedures and even prior to procedures, what's going on in the mind around the anxiousness around certain things. And so for us, that was critical to say, well, let's start with why most people would take CBD or self-report. And they self-report around pain, sleep, and anxiety for the sake of overall well-being. That's a well-known survey of over 2,000 people, why they self-treat. And so those were the primary endpoints for that first big study of ours with over 500 patients. Long story short, those two things alone speak to the critical importance and how paramount it is for us to third-party test and invest in patient data as well.
Well, you clearly both are leaders in your fields, and I love how both your products are so different, but both effective in achieving the same goal, and that's to make patients feel better. Now, one last question for both of you before we wrap up here. So, from your own perspectives, how do you think offering these products revolutionizes post-procedure routines and ultimately changes the industry standard for care? Lana, you go first.
Well, first of all, I want to say, just as a testimonial to Corganics, we talked about a few weeks ago, my procedure that I did, the vaginoplasty. Well, I used their product, the oil, the gel caps, and I used it throughout the process. And no doubt it contributed to my overall feeling of well-being, the fact that I had no swelling, all of that. So I really love his products and what they can do for patients. The CO2Lift carboxygel is revolutionizing post-care. We're looking at some plastic surgeons, for instance, are calling it the new gold standard of post-care because, again, it's not just the surgery. They can only accomplish part of it. Then the body has to kick in and start healing. And like what Corganics is doing, it's really just putting your body in a position to be able to heal itself. And that's what I love about the CO2Lift. And then its versatility, in terms of it can do so many different things. But as we're talking about patient comfort, patient effective, the immediacy of it, the versatility of it, that's what CO2Lift is doing. And we're really, and it's, as Reggie said, education is so important now to just help people to understand. It's a new category altogether in skincare, in post-care, in pre-care. It's something that we think of as, as the Windex of skin regeneration.
Now, Reggie, I'd love to hear your perspective on how you think offering these products revolutionizes post-procedure routines.
So Lana said it. I think a new category versus just a new product or a different product, it doesn't do this justice for either one of us. And so if you're introducing a new category, then you will almost by default say, we're investing in something that will become what's next. And that's what Lana and I have done pretty much our whole career. And so when you see the light bulb go off with healthcare professionals who have not been have not felt connected in a meaningful way with a large segment of their own patients who are self-treating and not getting answers from healthcare professionals, yet this is a safer, more alternative, natural solution, which, by the way, as Lana said earlier, for a lot of reasons, that is just in the zeitgeist in general. People are seeking those out. And so if we can help them do that with their patients and enhance those experiences, then, I would be more likely to refer a practice that did that for me. And that is the lifeblood of all practitioners, especially today. So if we could play a critical role in that process, then, mission accomplished.
Well, we are officially out of time. I thank you both for joining us today. It was such a enlightening conversation filled with knowledge and transparency. Lana, thank you so much for coming on again.
Of course. And Reggie, thanks for joining us.
My pleasure. Thanks for having me. I truly enjoyed it.
That was CO2Lift's Going Deep segment, and that was founder of CO2Lift and Lumisk Skincare, the amazing Lana Kerr. Definitely check them out online at CO2Lift.com and on the gram at CO2Lift and at the Lana Kerr, 2 R's in her last name. And of course, head to Corganics.com to learn more about what co-founder Reggie Gatewood is doing to bridge the gap between healthcare professionals and their patients when it comes to CBD therapy. And do check them out on the gram at Live Corganics. You're listening to A Moment of Zen right here on 710 WOR, the voice of New York, iHeartRadio. We'll be right back after this.
A Moment of Zen is brought to you by CO2Lift. As we age, our skin loses moisture and elasticity, causing wrinkled skin. You can reverse this aging process with CO2Lift. CO2Lift utilizes the powerful benefits of carbon dioxide to lift, tighten, and regenerate your skin. This simple, painless at-home carboxytherapy treatment is scientifically proven to reverse the aging process. You will see reduction in wrinkles, increase luminosity, and improve pigmentation, sagging, skin tone, and radiance.
For more information or to order CO2Lift, ask your skincare professional or go to CO2Lift.com.